Welcome to Season 2 of Under the Sisterhood. Over the 31 days of March, we are celebrating 31 Women's March of Voices during Women's History Month. We will have intimate conversations that will uncover each woman's superpower and find out how they use these superpowers to help other women. That's 31 days honoring 31 women and their superpowers. This is a podcast to celebrate women and all that they do in our world. I'm Elizabeth Elfenbein. Let's get under the hood. Today, we're celebrating Dr. Laura Gemmell, a daughter, sister, friend, current OBGYN resident, and future reproductive endocrinology and infertility fellow at Columbia University. Laura grew up in Toronto and is a true Canadian at heart. She values her strong relationships with women and believes we should always strive to lift each other up. Laura is fiercely passionate about providing excellent healthcare to women across all ages and backgrounds in New York City, where she currently resides. I couldn't be more delighted to be celebrating Laura during Women's History Month, as she's been making history for many years. Welcome, Laura.
Wow, thank you for that introduction. That was really sweet.
Oh, I'm so, this has been an amazing number of weeks talking to such brilliant women, yourself included. So I'm so excited about today. It's Women's History Month, and it's so important to celebrate us everyday women doing extraordinary things. So why don't we get going?
Of course.
So this is the big open-ended question, and I feel like I'm saying this every single time, which I am. But if you would, please share your story, Laura. And I'll be very curious to hear where you go, like when it all begins. But let's go.
Yeah, so I'm from Toronto. That's where I grew up. I'm one of three sisters, so I'm the middle child. And I think quintessentially, I am a very middle child. I have a very mediating influence in the family. I went to an all-girls school growing up. And so from a young age, always respected women, and my peers were all women around me. I went to undergrad at Harvard to study pre-med, and that's kind of when I fell in love with reproductive endocrinology. After college, I went and I got a master's in embryology at Oxford, which kind of solidified my, love of IVF medicine. And that's kind of been my passion for the last 10 years. But the way that medicine is kind of set up is that you have to go to med school, you have to do residency, and then finally you can do fellowship. So it's been 10 years since I've been at Oxford, and I'm finally about to start my fellowship in about 3 or 4 months. So I am so excited. So now I'm living in New York. Both my sisters are lawyers in New York. So it's so nice that, our home away from home is now New York City. And so my parents are flying in and out every couple of months because the three of us are here. And then, it was so nice to reconnect with you via squash. And that's my story so far.
Oh, no, her story is actually a hell of a lot more than that. But I love the fact that you focused and that the influence, because I didn't know that you were an all-girls school growing up. So that would make sense that you would be so passionate about really being in a way of service to women. You know what I mean? I mean, that just totally makes sense to me. Were you when you were growing up in school, did you feel this sort of level of this fierce commitment to women at a young age? Did you have an understanding of that?
Well, I think one of the biggest benefits, there definitely are some negatives of going to an all-girls school as well, but some of the major benefits to it was I think that I, through my teachers, saw really impressive mentors and, people that I looked up to. And then I think that there was no, we just really tried to push each other, and everyone was trying to succeed. And there was no it wasn't really a competitive environment, and we were all very supportive. And so I had my guy friends through squash, and so I definitely had that male influence growing up. But academics, when you went to school, I wasn't even thinking about boys. I was just, with my friends learning and, having fun. So it was a cool environment.
I love what you just said. I can't imagine being in high school with all girls and, being in such a supportive an environment where it didn't feel competitive. Because I think even today, particularly, whether it's in school, whether it's in the workforce, particularly at those young ages where women, where you want that support, you want women to lift each other up. So to be able to go to a school that sort of, that it sounds like it's almost in their mission to ensure that you're doing that, which is just a beautiful thing, because it's a role modeling of behavior that you can bring forward. And I have to say, I know Laura, and I know both of her wonderful sisters, and they've always been very supportive, competitive on the squash court, of course. I met Laura when she's, I don't know, it was
Probably
14.
like 9 years old. I feel like it was
I,
young when I met
it was
Olivia.
young. I mean, but Laura was on the international tour competing at the highest level. I mean, she was top 3 in the world, like as a junior, like just extraordinary player. And she played with such grace, and you really conducted yourself. It's like you brought that lifting other women, even when you lost, you had that smile on your face, and so much, you could feel so much love for the sport and for your fellow sister. And so I think that that's been, a really wonderful quality. So you go off to college,
Mhm.
you're pre-med in school. Talk about, like, how did you, like, where was that seed planted on, on women and fertility in particular?
Yeah. Um, I don't know if you know this, but it was when I was in high school, when I was in 11th grade. Um, First of all, no one in my family or extended family is in medicine remotely. Like we have no doctors, no nurses,
It's
nothing.
crazy.
Yeah.
Wow.
And then when I was in 11th grade, my dad got diagnosed with oral pharyngeal cancer, which is throat cancer. And that was kind of a huge shock to our family. So he was lucky enough through his work to get a consultation at Memorial Sloan Kettering in New York. And he actually moved to New York for probably 4 or 5 months um, and moved with my mom. And then me and my 3 sisters moved in with my grandmother in Toronto. And I think that was kind of like the first big traumatic thing in our childhood because it was huge. Like our family was very close. And then when your parents are moving away and I moved with my grandma, probably 16 years old, my grandma's teaching me how to drive, which is why I'm a very, very cautious driver. But I think that was the first time that I was always a science nerd, but that was the first time that I kind of learned about medicine. And kind of, I saw him through his treatment. He got chemo and radiation, and now he's been cancer free for 10 years. But I actually in
Wonderful.
college reached out and I used to do research at Memorial Sloan Kettering in the summers. And I was really interested in oncology because, I always thought I was going to be something science related. My mom is a chemical engineer. And so but then I saw like, I'm also a big softie at heart. And so seeing, the wonderful things that medicine can do and helping people through these like difficult moments of their lives was really inspiring to me. And so I was kind of set on, I was going to be pre-med when I started Harvard. But then again, being a softie, I thought that oncology was a little depressing, to be honest, even though it's a wonderful field. And so OBGYN was kind of the opposite of that. OBGYN was, bringing life into this world and more uplifting. And I loved it. And so I was kind of exploring the different OBGYN. What another thing I love about it is it's so diverse. Like people think about the OB aspect, which is obstetrics, just delivering babies. But the GYN aspect of it is also, really diverse. So there's GYN oncology, where we take care of women with endometrial cancer, ovarian cancer. There's REI, which is what I'm going to do, which is taking care of couples struggling with infertility. And so, yeah, and that's kind of the infertility is where I found my passion. And I'm so fortunate I can actually do it starting in a couple months.
That's awesome. I want to go back for a minute. You asked if I don't know. Of course, I remember your father, and I remember them moving to New York for treatment and everything. And that must have been so hard. It's so interesting that that's an inflection point that really made you decide to go into medicine. Because I remember you were a science nerd, but I also knew when you went off to college, even though you were playing sport there, I also knew that you were a pre-med major. And to go in with a premeditated pre-med major,
Yeah.
pun intended. All right, yes. But I mean, I think it's really interesting. And it didn't dawn on me that it was related to watching your father go through that. And I think you're right. In terms of oncology, it's a really hard specialty. It's a much needed and a beautiful and wonderful specialty, but there's a lot of sadness in it. And so I can understand. And interesting that you commented versus OBGYN, where you're bringing in life. I was just having a conversation with a doula, Ildi Sebastian. She's from Hungary. She lives in New York, and she's a doula now. And she talked a lot about the pain, her mother's miscarriages, and then bringing, really wanting to bring life into this world and the beauty of that. So I think that it's interesting because you get to practice the science, but to your point of the soft side of it, you get
Yeah.
to see this goodness happening. But I would argue, though, going into reproductive endocrinology and fertility, that area, you're
Mhm.
going to have the same sort of, you'll have some people who are very successful with it. It won't always be, how are you feeling like understanding that, you
Yeah,
know?
I think that I think REI patients or infertility patients are some of the most resilient people in this world. Like I think struggling with infertility and like not being able to um, conceive naturally, I think can be extremely difficult. And I think there is a degree of sadness to kind of pursuing fertility treatment. But I also think that there's a huge degree of hope. And then I'm also, again, back to being the science nerd, I love research. And it really is a field where the things that we're doing today are very different than things we did 5 or 10 years ago. And so I think there's a lot of hope and there's a lot of progress. And I'm excited to, start my career and then for decades, you're able to help women. So, and women and men. I have to forget that I'm taking care of men as well as part of the couple. But I think that's what I'm kind of seeing it is that there is definitely sadness to it, but the hope is hopefully going to outweigh that.
Yeah, no, I mean, yeah, no, it definitely sounds like a, thank you for sharing that. Laura, I just had a question. I mean, if you're going to be at Columbia University, are you going to be doing research within the REI field as well? Will that give you
Yeah.
the opportunity to
Yeah.
put on
So
that more scientific side of you, right?
yeah, 100%. So the fellowship is kind of half clinical, half research. So there is a time, I think, for 18 months when you're kind of just doing basic science in the lab. So that's
Mhm.
really nice.
That's awesome. That's really wonderful. I mean, imagine, to your point of it's changed a lot in the past 5 years. Imagine if you are going to be part of the change in the next 5 years and the next 10 years and the next, I mean,
Yeah.
you could end up being the one. So everybody got to watch Dr. Laura Gemmell at Columbia Presbyterian. So I'm curious, when I introduced you, you talked a lot about your passion and commitment for women and women in health. Why? And I know the conversation around the oncology versus OBGYN, but talk about like how you feel about this whole experience with women. Is there something burning in you that you came across? What is it that really, was it just life versus, cancer? Like,
You're saying like when my desire to help women as a physician, I
yes.
actually, I don't think I think when I chose OBGYN, it was both like an academic interest and then also, obviously I thought it was, a happier side of medicine and I was excited a huge part of OBGYN is also surgical. And so, me as like a prior athlete and a lot of OBGYN is using your hands, being in big surgeries. And that was really appealing for me. But I think as a resident, that's when when I truly was responsible for these women. I think that's when my perspective slightly changed that I was like, no, like I am an advocate. You know, I am here for these women to get them through this part of their life. And that's the part that I like cherish so much is, being a doctor.
Well, I think it's really interesting going back to your childhood of going to the all girls school. And I was just like, as I read your introduction, the fact that you are, very passionate and a fierce advocate for women,
Yeah.
it's almost coupling the two together. And it's interesting how you put that. So I think that's just wonderful. I mean, the world needs more of you. So this is just really, really fantastic. So how do you imagine, like, so you're gonna start your fellowship. How do you imagine this part of your life as you move forward, as a woman in medicine, as a woman doing REI and taking families on this journey?
Yeah, I can't wait for fellowship. I think, firstly, my quality of life will get a lot better. I think being a resident in New York, your hours are crazy, but I think that's because they want to train you well. So I'm really like super appreciative of the training that I received at Columbia. But I think it's going to be it's funny. I've acquired kind of all these skills as an OBGYN, like delivering a baby, doing a C-section that I'll never do as a fellow. So now it's like a completely different patient population. But I think that's also really exciting. And so I'm kind of just going to take it one step at a time and kind of see how I start off August 1st. And I have I already know all the faculty here at Columbia. So I'm already on a bunch of research projects with them and, they're going to, I'm just going to follow their lead and, see how it goes.
That's awesome. So in doing IVF, will you be doing those procedures in terms of,
Yeah.
you'll
So
go through the whole process?
Yeah, so what primarily my job will be is that you see patients for like new consultations, so like couples that are struggling with infertility, you decide on kind of the treatment modality that you're going to go with. So some couples need something called IUI, which is intrauterine insemination. Some couples need IVF, which is in vitro fertilization. You'll do like egg retrieval procedures, especially for patients that want to freeze their eggs or freeze their embryos for future fertility. You'll do embryo transfers, which is when you've grown an embryo in the lab, you transfer it back, to the woman, hopefully to implant. And then you follow them up to kind of 10 weeks of pregnancy, which is when they graduate and then they can go to an OBGYN. So I'll send them to all my friends.
Oh, that's wonderful. And I think what's really interesting about that, Laura, just hearing you describe the process and the different types of IVF
Mhm.
is the fact that the real science behind it. So you get the patient, it really mirrors what you talked about early on, which is like I'm a science nerd. I get to do that piece, but I also get to, the humanity piece, which is really important, and to get them to the 10 weeks and send them off to your friends, which is really beautiful. That's awesome. That's really wonderful. So I'm not sure if there's anything else you want to tell about your story as a woman before we move on to the next question.
Yeah, I'm not great with open-ended questions about my story as a woman, but I am an open book, so you can ask anything you want.
Well, that's a good answer. I'm not sure I have the perfect next question. But no, but it's been really wonderful to watch you as a woman and as someone I've known you from a young age. So to see you grow up, as I said, at a young age, you had so much grace. You were so poised and contained. You were a fierce competitor on the court, and yet, at the end, whether you won or lost, you would walk off the court and you just such a lady and such a refined individual. And it's just been wonderful to see your growth and to see where you are today. And more importantly, from my perspective as a woman, as the founder of Under the Sisterhood, is what you're doing for sisters, what you're doing for women, to help women. It's such a beautiful thing. It's a wonderful story. And I'm pretty much in awe of you. I mean, I was when you were younger because you're just one of those, but you kind of quietly went off. So when we came across each other, I was like, wow,
I
wow, you're doing that.
I
It's
feel
just
like we
like
hadn't seen each other in like 10 years. Like I feel like
10
it had been
years.
so long. Yeah.
10 years, 10 years. And meanwhile, she's done IVF research at Oxford. She's finished her med school. She's finishing her residency. I mean, unbelievable. So that's fantastic. So this question, I love this question because it really forces us to look within and really, say, what are superpowers, Laura? And I say plural, because we have many. How would you rate them and talk about them?
Yeah, I think my superpower is a superpower that a lot of women have. So I think it's resilience. And so I think whenever I go through anything kind of hard or challenging in my life, and kind of I spoke about my father, his illness previously, I think I am someone that tries to, stay calm, stay optimistic, kind of, I'm a problem solver, and then kind of just like grit and get through it and then like move onwards towards my whatever goal I have. And so I think, especially as a resident in New York City, resilience is kind of the number one thing that you have to have. And I'm actually on the admissions committee for like future residents for OBGYN. And that's like the number one thing we ask whenever we interview anyone is just like, tell us a time in your life that you were resilient. But I think it's not I think it's a super common superpower. I think a lot of women have that. A lot of women go through shit in their lives and they, go forward. So I think it's really important.
So that's one. What would you say your second one is? And that's a great, by the way, yeah, resilience, grit, determination,
Yeah.
amazing. And I love the fact that that is a question in the women or the people that you're bringing in to do OBGYN residency, because
Yeah.
I think it is important.
We one of my co-residents, her name's Anna. I absolutely adore her. She's going to be an MFM, which is maternal fetal medicine specialist, at Cornell next year. So she also matched for fellowship in the city, and she's interviewed a lot of like applicants for Columbia. And her question, and what she always says, is that Columbia is looking for what did she say? Grit and sparkle. She's like, grit and sparkle are like the two things that
Ooh.
she wants in residence. And I was like, I think that's great. I like completely agree.
Well, because the sparkle, back to your comment earlier, is the hope. It's the
Yeah,
optimism.
yeah, that's what it is.
It's that, it's just that I've got this, and it's an energy. It's an
Yeah.
energy. It's like, that's what you want in walking your halls of the OBGYN floor and in your surgeries and stuff. You want that high energy, that positivity.
Mhm.
But then you need the resilience, you need the grit. What would you say your second superpower is? Or, yeah, you don't
My
have to name it number.
Oh yeah, I can list all my superpowers. Like, I can fly, and then I can this. I'm just kidding. Um, I think empathy, which again is like a really common superpower, but I think I'm like a very empathetic person. And I think especially in medicine, that's really important because I think a lot of people, when they go to the doctor, like one of the most common complaints is that the doctor kind of just like speaking at them and like not really listening to them and not really caring about, their values and what they want in this experience. And I think especially on the labor floor, like we have people come in all the time that have their birth plans, and they labor is a scary experience and it can be unpredictable. But a woman has to be like, they have to feel empowered in that experience. So I think being able to empathize with your patients and really put yourself in their shoes and understand what they're going through. I think I think I've always been empathetic, but I think I'm like super empathetic now.
Oh, that's wonderful. And I actually like that contextually, the way you put it contextually. So yeah, a lot of women have empathy and are saying that they have empathy, but empathy is a wonderful quality. I think when you put it into really, and you use the word listening as well. I mean, I would imagine, you're right. Women have to feel that they're empowered, and it's a really scary time having baby. The
Yeah.
beauty of having a baby is amazing. The experience is really scary because until you've experienced labor, there's nothing like it. And
No,
so I
it
think
really
that
does not like it.
nothing like it. In fact, but so I really appreciate you saying that. Because as a doctor, I want to also say it's wonderful as an OBGYN. And I think OBGYNs might have a little more empathy than most doctors, but most doctors don't listen. You feel more like you're a number. They're there
Yeah.
to give you their clinical diagnosis and their treatment plan versus, hey, understanding who I am and what my needs might be. So I think that that's just a wonderful quality that will serve you well. And I think it's interesting because I also think that your generation of physicians are changing. There might be, I don't know if you had that in med school where there might have been a class that addressed whether it was empathy or bedside manner, they might have called
Yeah.
it. Yeah.
We actually
So,
did, and I think it was super important. And I don't think that it probably was part of the curriculum 10, 15 years ago in med school. But it definitely is part of it now. And they actually bring in some like standardized patients, which are actors who pretend to have whatever illness they're supposed to have. And then you as a med student actually have to interact with them. And another senior is kind of watching you, and they're not judging you, but they're like giving you tips about your bedside manner. Because I do think some bedside manner is just innate of like you as a person, but it also is a skill that you can get better at. So I think 100% it is important in medical school and even in residency to like continue to practice and develop that skill.
and it's funny that you say that. I had an instance, I want to say this might have been, I don't know, maybe it was 10 years ago, maybe 11 years ago. My OBGYN, which is really my GYN, my gynecologist, I was in there for a routine exam. She took my blood work. I go to my internist, I get blood work taken by everyone in the city who had my whatever. But anyway, so she took my blood work. I get a call like 6 weeks later. Hey, something up. I think your thyroid's acting up. So she sends me to an endocrinologist, and she sends me to a guy, Harvard undergrad, Cornell, whatever, like very NYU, apologies, NYU med school. He was at Cornell. And I went in, and he was apparently supposed to be a great doctor, and he treated me like a number. And
I'm sorry.
so, it was awful. And so I go back for my second visit, where he has me do these tests, and he's talking to me like I'm an idiot, like I have no idea. And so I just start taking notes.
Mm,
I literally write an article. It is live within 3 days on Media Post. It's out. I am a patient. I am not a number. But my point in telling you the story is, I would say the guy's probably now in his late 40s or what have you. He was an awful doctor. He might have been well qualified clinically, but he had
yeah.
no concept of bedside manner. And so I moved to another physician, and I went to my internist and I said, do you have someone? And I said, can I do anything organically? And he said, you're going to need treatment and could for the rest of your life. So no, you have to go. I ended up getting this woman endocrinologist who was phenomenal, and her love and understanding of the patient was magnificent. So I think it's something, it's wonderful that you've already experienced that. You're right. It is innate in you, Laura. So that's a great quality. But for doctors who might be more scientifically oriented,
Yeah.
it is a skill set that they can learn enough to
Yeah.
not be like that gentleman or that doctor,
And it's also, there's so much jargon in medicine that I think like when you explain things in more plain terms, like patients are not idiots. Patients can understand what you're saying. You're just like speaking a different language some of the time. Like for example, when I said my dad's throat cancer and they said oral pharyngeal, you're right, like average person wouldn't really know what that means, but if you say throat cancer, they get it. So I think like talking, just avoiding jargon is like the number one thing that you can just, try to get on the patient's level right away. But I'm
Yeah.
sorry you went through that. That's awful. And I'm glad you
Well,
found something that you liked though.
yeah, no, and I'm cured. He would have had me do this, like, I don't know, a surgery type of thing.
Mhm.
And she said, no, we're going to give this a go for 18 months. And she gave me a 33, 33, 33, cured. You'll have to do the medicine again, or we have to remove it, but let's try this first. And I've been cured. I mean,
That's great.
lifestyle change, so it's fantastic. But I think the biggest thing that I felt was I felt seen and heard. And I think that's a great quality that you're describing in your empathy.
Mhm.
I know that you have more, so I'm going to ask you one more superpower, although those are fantastic. Resiliency and empathy are fantastic superpowers.
I'm trying to think of another one. Um, it sounds so generic, but like determination, I guess. Like I think I'm a very determined person. I think you saw that when I was younger, like when I would have a goal in squash, like I would just train super hard to achieve that goal. And I actually looking back, like I don't think that I was the most like physically gifted or just like naturally the best athlete. I actually think that I just like put more time and effort into it than my peers. And so that was something that I learned, in my teens and then carried forward in my career as an adult. But yeah, I think that when I want to achieve something, I have an ability to kind of just focus in on it and just do the work.
That's a fantastic superpower, the determination and the focus. And I think that doing that in sport for all those years has given you a life skill, like that has just so nicely slid into the rest of your life in
Mhm.
terms of helping you be, and you will become and be an incredibly successful doctor, because you're not afraid of that discipline and the determination and the focus that it takes to get to where you want to go.
Mhm.
So that's just wonderful. So how do you, I mean, this is the last question, but how do you use these superpowers? Although I do have a secret question afterwards. How do
Oh,
you
I
use
want to
these
hear the
superpowers?
secret question.
Not until you answer this one.
I have to get
How-
through this to get to the
Yeah.
secret.
How do you use these superpowers to help other women, which
Well, I think going to I just said determination. So I'm extremely determined with my patients. Like if my patient comes to me and they have whatever complaint they have, like I will get to the bottom of it. I will work hard to make sure that, we are treating them appropriately. Um, and yeah, so I think that that is just like me as a doctor. I'm a very determined, person. Um, I said resilience. So I think resilience is also important for your patients. And I think maybe on the labor floor is kind of the best example of it, is that when patients are going through labor and it's unpredictable and things are happening, they have to show. I've seen women show like amazing degrees of resilience, but I think as their provider, you also have to be resilient.
mm,
If I delivered one woman and it was a completely like uncomplicated labor. She delivered, it was beautiful. She was bonding with her baby. And then she had a massive hemorrhage where she lost 1.5 liters of blood immediately due to something called uterine atony. So sometimes the uterus after you deliver, it doesn't quite contract, and uterine atony just means the uterus is kind of like boggy. And it's the number one cause of postpartum hemorrhage. And so you have to kind of stay calm, give her some medications. Sometimes you have to do, blood transfusions, things like that. But you have to quickly be able to adapt. And so I think that's where kind of the resilience comes in. What was my other superpower that I said? Oh,
empathy.
empathy. Well, I think empathy, that's just, as a doctor, that's an important quality that I use with my patients all the time.
But how do you use that? And I think that's beautiful, and we'll get to that in a second. But how do you have these amazing qualities that extend beyond you as a doctor and a physician, how you serve, the women in your life. Would you say you apply all the same things? You know what
Yeah,
I mean?
I'm really, really proud of the relationships that I have with women that I've developed over the years. Like I actually, so right now I'm on the nights rotation. So I am working crazy hard this month, but then next month is my research month, which is wonderful. And so part of my research month, I get elective time where I can actually travel and like go on vacation. And so I'm actually going to California with two of my best friends that I met at Oxford. And I was only at Oxford for 12 months, and two of my best friends, two amazing women, who both I met them, they were both pre-med at the time, but both now are consultants at McKinsey. So went a slightly different route. But we've just stayed so close over the last 10 years. One lives in England, one lives in Australia. But we have a text thread that we are constantly texting each other and like updating each other in their lives. And I'm going to turn 32 in a month. And so we're spending my 32nd birthday at Joshua Tree in California. And so I am just, so proud of the relationships that I've developed. And I think women are just incredible people, and, definitely the superior of the men and women race.
I would agree with that, but that's so beautiful, Laura. That's just
Yeah.
wonderful. That's
Like,
really wonderful to hear. And I do want to say that the way you serve your patients, I mean, on one hand, obviously I can't be your patient, but boy, I would have wanted to be your patient. I know I would have been in really good hands. I would have been,
thank you.
really, really comfortable. So thank you for sharing that.
Mhm.
So this conversation's been awesome. I have this last question, which is really, this is your platform today to
Mhm.
speak to women of all ages, of all backgrounds, of all cultures, and from, of course, around the world. What do you want to say to them? What's your message to women?
I think this is a really hard question. Um, but I really think that the number one message should just be to completely be yourself. Think about what is important in your life, and then don't let anyone kind of steer you away from accomplishing that goal. I think there's been a lot of discrimination, and there's a lot of sexism in this world. I think we've come a long way. But even, in my short lifetime, I've noticed a degree of sexism that is not all right. And so I just want women to feel empowered and proud of who they are, and, to not let anything kind of hold them back would kind of be my message. And I know that sounds super generic, but I think it's important. Like, I think instilling confidence in young girls, that probably was a big component of my life, is like going to an all girls school, and really like having the confidence of, oh yeah, there's no difference between girls and boys from like a very young age of what we could accomplish. Definitely was a huge part of my personality. Yeah.
And that's beautiful. Thank you for that. And also, I think the other thing, you had the benefit of growing up with two sisters and a mother. So your
Yeah.
family, your father was the only male, so it was so women
He was
dominated.
outnumbered.
Yeah,
Mhm.
but the beauty is sort of the role modeling. Your mom was what, a biochemical engineer? I mean, she's a wonderful woman,
Yeah.
wonderful mother. But I think the important thing is you saw that she could do, that
Yeah.
she could, and that you could do anything. And I think that telling women around the world to just be yourself, go for it. If you have a goal,
Yeah.
focus on it and don't give it up for anyone. And in terms of sexism, it freaking sucks. I mean, yeah, I mean, it still exists. Is it existing a little less here and there? Yes. When you have very conscious leaders saying this is not okay, being held accountable to certain standards. But unfortunately, it still exists. I do have one question on that. Are you experiencing that in the healthcare system? Like
Well, it's a little, at least for the OBGYN world, we're heavily female now. Like, we used to be a heavily male profession. Now we're heavily female. So we're like actively recruiting guys, because we just don't have any, which is interesting. But I definitely know that my friends or my colleagues who have gone into other fields of medicine, have experienced it like in the workforce. And I think that it can be difficult, especially a lot of my friends who became surgeons, have told me that, of like, there definitely is in some places, in some cultures, a theory or a thought that like cannot be as good surgeons as males. And that's not like, I don't think anyone's outwardly saying that. But I think that's just a bias that some of my female colleagues have said. With OBGYN though, again, we're all women, so we're all surgeons, and we're all great. So
Yeah, that's amazing. And I did hear the same thing in terms of surgery. My daughter Georgia's best friend, she went to school with, she went to Harvard Med School, and She was in, I think it's Mass General, whatever the hospital is affiliated with Harvard. Anyway, she's a surgeon now and
Mhm.
a surgical resident, and it's been tough. I mean,
Yeah,
they feel like they look at women and,
yeah,
they're like, you can't have a family. You're not going to make it in this. And we've had a lot of conversations about that. So I
yeah,
think you are fortunate you've chosen a path in medicine that is predominantly women and women focused, which allows you guys to just shine and focus on being doctors and not dealing with the politics of women being doctors. You know what
yeah.
I mean?
Mhm.
You know.
100%,
Yeah.
100%.
But anyway, this has been just an awesome conversation. I am so grateful to be here today celebrating you during Women's History Month.
Thank
You're
you.
going to continue to make history. We are going to be watching you, Dr. Laura Gemmell.
Well, thank you so much. I'm so happy about this opportunity and I'm so honored. And it was so nice to catch up with you because it's been so many years.
Mm. Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Zach Slaff, and edited by Zach Slaff. The music is by Ayla Schaefer, her song, Rose.